All right, welcome back, Pelvic Health Essentials. This is week 5, and this is a week that I would love to have dove into from the first week because there's so much I could talk about here. This could be a whole course in of itself. Um, but I feel so strongly that the initial 4 weeks are so important to build the foundation for this session. And oftentimes that gets overlooked. Moms take courses on that focus very much just on exercise, and they're not getting a lot of that background, deeper understanding of how the system is working. So, yay, we get to finally get to exercise, which I know a lot of you have expressed that you want to know more about. You want to know specifics of what you should do. And I hope that I'm offering that today. And I will be offering it over the next week as well. So you're going to receive an email each day with a recording of me going through a certain series of exercises. So let's get into a little bit of content and just building a framework for exercise, particularly in postpartum. What's best, functional or formal exercise? We'll talk about that real quick. The stages of postpartum exercise, and this is, again, my perspective. This is kind of a model that I've developed and work off of. And then we'll talk about foundational exercises and what those are. I really should say foundational activities and exercises. And then I'm going to give you a little hint of what this video series is going to be. It's not just on the Facebook group. It will also just be sent to you via email. So whichever way you wish to access it, you can. All right. So again, a disclaimer, because I am talking about exercise and I'm going to be providing instruction on exercise. Of course, with any new or different exercise routine, you want to know that you are medically stable and able to perform those things. So some of what I'm talking about today is not intended for early postpartum at all, and really is more intended for after you get that medical clearance. Now, I say saying this because these guidelines are a bit arbitrary, but I always, if you have any doubt over the safety of you doing any certain exercise at all, you should be seeking out personalized professional support, of which this is not. This is educational in its context and purpose. Okay, so I'd like to start a little bit with my story of postpartum movement, because movement has always been a part of my life. I love to exercise, I love to move, and I had so much trouble in postpartum, particularly after my second, in finding a balance between movement and being a mom and finding things that felt good, and not just during it, but also with the before and after. And kind of how I now engage in exercise looks a lot different, and it's been a journey. And so I just want to offer you a few of my tips or things that I've learned along the way is certainly the easing in slowly. There's a reason we need to rest in postpartum. And when we do that, we do heal and progress through a return to exercise and movement much more smoothly. So a lot of the things I've been talking about in the past weeks are where you want to spend your time in those early weeks, rather than what we're talking about today. There are some things, of course, that you can do in the early weeks that are like movement, but I encourage you to more be focusing on that mind-body connection, and we'll talk about that more. Being patient with yourself, it's a journey, and the 6-week time frame is actually somewhat absurd. I think it should be more like a 6 to 12 month time frame that we hold in our head in terms of returning to what you may perceive as a normal exercise or activity routine. 6 weeks is very intense to be able to think like by 6 to 8, even 12 weeks that you'd be back to somewhat of a routine that looks similar to what you were doing before you became pregnant. And you really need to be in tune with those body signals, which is why that mind-body work is so important. I see a lot of moms who have gotten injured or had not major injuries, but injuries that disrupt their return to exercise because they didn't spend that time. I think a lot of it has to do, they didn't spend that time reconnecting. Um, Seeking out what feels good before, during, and after. So what do I mean by that? Like before, so it's something that you can engage in that is available in your day as a mom, in that like you can find the space for it and find the time. So that's the before. The during, it should feel good. It should be like, oh, I'm so glad I'm doing this, not worrying about or feeling overwhelmed by it. That's not going to be productive. And then after that, your body isn't needing recovery from it, but is responding well. And you're able to return to it within a couple of days, if not the next day. Considering new forms of exercise. So I was very much a surfer and a boogie boarder before I had children. And I still do those things, but they're not a primary source of movement for me because you can't do them with children. So that I had to start look, and it's hard to go to a yoga class with children. They have the mom baby yoga classes, but those only go for so long. Once your kid's walking around, you're kicked out. So opening up your horizons to what are different options of what I can do, because it may intend to return to this form of exercise, but I encourage you, if it's just not feeling right, to explore others. So that goes to that last point. What worked before just may not be what's best now, and it may take some time to find what is best or what feels right, and it may shift and change over time as well. All right, so functional movement, which we talked a lot about last week, versus formal exercise. Like, what's better? I think there's pros and cons to both, and I want to highlight those. So functional movement is movement you do through your daily routines, through your daily activities. So you're washing dishes, instead of just standing there washing dishes, you're concentrating on your posture and your standing and your breathing and your alignment. The pros to that is like, you got to do your daily activities, so you may as well do them with some more intention. Doesn't take extra time out of your day, and is great for building a foundation to formal exercise. The challenges with it, though, is you do need that awareness, which a lot of moms don't have. They haven't taken a course like this, or they just don't know what to concentrate on. It requires a plan. Like, you have to think about it, and you have to be motivated. So, and you're not going to have someone really holding you to accountable unless you have an amazingly supportive partner or housemate, husband, whoever that might be, that sees you day to day and is like, hey, have you been working on your posture today? Which I think is hard to come by. But if you do have that, that's a great and amazing. So formal exercise, this is more purposeful. It's like I was doing Fit for Mom here in Honolulu. And I love their classes, and their focus is on getting your cardio and your muscular strength back. It's laid out for you. If you're going to a group class, like you just show up and you do it and you listen, and like it doesn't require as much brain power, which can be great. You don't need as much body awareness with lots of these things. Like if you're going to the gym, you might be using machines to kind of set you up in good body positioning, or riding a bike. Like generally you're better positioned. Whereas more dynamic movements, like things around the house, can be more challenging to figure out what body positioning do I need to have. Accountability is a lot easier. It's more familiar. It's great for performance goals, like if you want to get to somewhere. But it requires time. You gotta chop time out of your day, and that can be difficult early on. So it doesn't mean you can't exercise. I just suggest this more functional route for you. There is an increased risk of injury, absolutely. Because if you're weak, or you're not spending the time building that foundation, and you go into something that's a little too intense after not exercising for a couple months, there's an increased risk of injury. And it can be hard to sustain showing up. Motherhood gets complicated, and I think we all know, like, we can't always sustain getting to a class. So I always suggest early on, focus on the functional. Later, once you've built that foundation, you're feeling like you have a bit of a rhythm in your day, then start seeking out more formal exercise and not holding yourself to a timeline for that. It will arrive. It may not be as quick as you expected. It may be 6 months. Is that okay? Yeah, it's fine. And I think it's great if you are doing this functional movement. Um, with the functional movement, having a plan for daily check-ins, like maybe little post-its around the house. So I'm a fan of that. How are you gonna stay accountable? Kind of like, what is your goal? Does this motivate you? Why? How does it motivate you? So kind of reflecting on like, how am I going to keep showing up and doing this to make it so that you're seeing improvement. I mean, if we just check in with our posture once a week, functional movements, you're not going to notice a whole lot of difference. It's a daily returning to it. Because it's these little micro moments that add up. And so if you're not getting enough of those micro moments, you're not going to see much change with functional movement approach. It's also a great way so maybe you've gotten out of a formal exercise routine that you had been in, you're trying to get back. I encourage moms spending a few weeks in this functional movement stage, really trying to pay attention to their body and their breathing, doing some very basic initial exercises, and then going and attending that class or starting that running routine or whatever it might be. For the formal exercise, I can't emphasize enough that establishing a baseline of functional strength, which we'll talk about today, what could help you get there, stability, and just general body awareness. This is all to help ensure that you can continue doing that. So, and that leads me to why I posted this picture. I returned to boogie boarding really early on in postpartum. After my second, I was like, oh, well, getting in the water feels so good. So I'm just going to make a bigger intention this time around to do it. But what I didn't do was get this baseline functional strength, stability, and body awareness. And I think it was a major contributor to my diastasis, which is kind of severe and may not completely ever heal. I can manage it at this point because I have gone back and gotten that functional strength and stability and awareness. But I don't think I would be in the seat I am in terms of my diastasis today if I had done that baseline work. So it's not just what's going to be enjoyable, but are you prepared for it? Is your body prepared for it? What's your plan? What's your goal? And how much time per week can you commit to it? So looking at this, if you're really unsure, you might want to look over here and starting there first. Okay, so the stages, it's not really it should be perinatal exercise because clearly the first stage is prenatal. And this is the preparation stage. And then after birth, we move into this reconnection stage. This is all that baseline work, that mind-body work, that breath work, that reconnecting to your pelvic floor, reconnecting to your core. Can you align well? That's all that reconnecting, which is going to protect you and reduce risk of injury as you move into this mid-postpartum stage, which is I would call ramping. This is when you're really starting to ramp up the amount that you're doing. And then you're looking towards getting to a phase where it's more maintenance or maybe even performance, like having a goal, like I want to run a 10K. Or I want to be able to hold a plank for 2 minutes, whatever that performance goal might be. I want to get my pre-baby body back. That's a performance goal in my mind. And there's a process to getting there. And when you skip a stage, often you're going to get knocked back to a previous stage because your body's not ready. And whether you are aware of that or not, I think depends a lot on how much you've thought this through and planned it out. So hopefully by the end of today, each of you can walk away with a better plan of where you're at. And I give some numbers, timeframes, because I get asked for those a lot, but they're very arbitrary because everyone is in their own situation. So even if you are 10 years postpartum, you very much could be in this reconnection phase because you never did that work. And that's okay. And some of you may really go through, you've prepared well and you're reconnecting well, and now you're right onto the ramping up phase and it's only 3 months postpartum. Great. It's different for everyone and there's no right or wrong. So pregnancy, this course isn't really designed for that. In fact, as I was making this presentation, I was like, ooh, I could do a little mini course on this. This would be fun. So I'm putting it out to you guys, and then now I have to do it. So talking more about what is this preparation stage. So the key areas of focus are, of course, preparing for birth and labor, maintaining alignment, body-mind connection, core stability and strength, glute and hip stability. So the better you maintain things in this stage, the better and easier that reconnection phase is going to be. If you're only doing the first one here, preparing for your body for birth and labor, well, there's some elements of this involved there, but I think you're reconnecting to your body may take a bit longer. So I'm going to do a little free webinar on this in August, so keep your eye out for that. So the reconnection stage. This is encouraging your body to repair and restore without injury. Reconnection to your body and mind, that proprioception. So proprioception, again, is your knowledge of where you are in space without being able to see. So with my eyes closed, I know where parts of my body, I can sense where I am, and I feel connected and in tune and aware of all areas of my body. Reconnecting to your core and pelvic floor, of course, and reconnecting to posture and alignment. So this is a lot of what we've already talked about. And generally, of course, it starts right after birth, or should start right after birth. And I think it really does take a good solid 6 to 8 weeks to get through this. Now, if you're later postpartum and this is the first time you're like, I didn't even know I was supposed to do this stuff, will it take 6 or 8 weeks for you? No, I don't think it will, because you're not having all these other things going on, like establishing breastfeeding and all the other newborn things. You're just trying to reconnect to your body, and you could really go through this process in a week or two, and setting yourself up for going into the ramping phase. All right, so what are examples of what you would do in this phase? I'm going to go through it quick because we've talked about most of this, but it's intentional, mindful, functional movement. And it should be done really until you do get that medical clearance, whether it's from a midwife or OBGYN. But in this stage, I think it's important for you to know that you can do pelvic floor therapy if you're having problems. There's no reason a pelvic floor therapist cannot see you even as early as 1, 2 weeks, 3 weeks postpartum. If you're needing that support, you can get it in this phase. You don't have to wait for medical clearance. But examples of this is that building the habit of blowing before you go. So reconnecting to the deep core, posture check-ins through mountain posture. We did that last week. I think it was last week. Kegel routine, start seeing how your Kegels are. How do they feel? Core activation, deep breathing, the morning movement routine, starting some walking. So you're starting to just do some real gentle, feel-good movement. There's no goal of time or how many you do. It's just what feels good and what feels right. Massage is great. During this period of time, I really encourage moms to get some massage and a pelvic floor screening. So to kind of also give you some clue in like, hey, everything's looking great, or you could use some support, or here are some exercises you should do before you engage in more formal exercise. And that's a service I do offer. It's a real quick appointment. Okay, so the mid-postpartum stage, this is when you're like, okay, let's go. I want to get moving. I want to feel like I'm not just lounging around all day with a baby on me. Like I want to feel myself move again. So areas that establishing that deep core connection and starting to build the strength back. Establishing a baseline of cardiovascular fitness. So like going out on a bike ride can be great. Establishing movement and exercise routines. So this is where you start to play with like, okay, how do I get exercise in because this is something important to me while also being a mom. And it can be hard. There's no right, wrong answer. I think this is where moms might seek out mom baby classes because you can bring baby along, making exercise easier to do, or you might engage in an online program. A program I love is called Restore Your Core. It's fantastic, and you can do it from home, and it's a great way to establish that deep core connection. You're not going to be doing cardiovascular fitness with this one, but you go out on a bike ride or a walk a couple times a week. That's ramping up. You're going to be building strength, building cardiovascular fitness, and you're going to start feeling more like yourself again. So you're slowly, I cannot emphasize the slowly enough, increasing the time, the intensity, and just your general tolerance for exercise. This phase, I really think you are staying in for months. You're not moving through this quickly. It's a work in progress. You could be here, I wrote 6 weeks to 6 months plus. This could be the whole first year or more of your baby's life, because this part, the routine part, is really challenging. So you might start ramping up, and then the routines start crumbling away. Baby's not sleeping good, you're exhausted, so then you're not doing the exercise. And so you can't start where you stopped if you missed a period of time. If you missed a whole week, I say don't start where you were, back up a little and start ramping up again. Give yourself grace. You are doing new things, juggling new things that you've never had to do before. And exercise is going to support that, in that you're going to feel more like yourself. You're going to be able to think a little more clearly. You're caring for yourself, which is so important. But you can't hold yourself to these strict, got to get done by this date. That's a setup for some failure. And then when we feel like we're failing, it's harder to motivate ourselves to get back on that horse. So there's no failing here. It's just trying different ways, getting back on that horse and going about it again. What else? Injury prevention. And if you start to notice an area of tightness, that you're doing something about it right away. Or you're starting to notice a pelvic floor issue come up, like we were talking about in week 2 or 3, and dealing with it in this stage. Okay, not, I'll deal with it later, it will get better as I get stronger. I tell you, no, likely not going to get better, only worse. Address it now. It's part of that ramping up phase. You may need to seek out a chiropractor. You may need to seek out pelvic floor therapy, maybe massage. Working with that team to help support your body to recover and return as healthy and safely as possible. So grace, patience, listening to your body, not ignoring those signals. So this is a process, and it's certainly not linear. It's a roller coaster. So seeking out support in this, I think, is great. So these Fit for Mom kind of classes, these mommy baby classes, I think are great for that, because it's that community. All the moms are in that similar stages, and it can be really helpful. So later postpartum, Fit for Mom also, and this is not an ad for Fit for Mom, it's just a program I'm familiar with. They also have these more performance level, I think they call it Body Well now. And this is without baby, but it's more about reaching those fitness goals. The areas of focus here, of course, are returning to those things you really enjoy, or exploring new things that are great, really enjoyable to you, that feel like you are more in tune with your body again. It's building strength, endurance, flexibility, which I'm going to talk a little bit more after the slides, and balance within the body. So finding that rhythm that feels good. So this is 6 months. I don't think you're really anyone's hitting this phase before 6 months, without maybe a whole team of support people around you. But most moms are hitting this phase later on in that first year. Okay, so what is foundational exercise? These are the movements that are safe generally, effective, and should remain a part of a well-rounded exercise routine. So these are a lot of the exercises that I'm talking to my clients about doing, and continuing to do. Now there's different phases of them, which you'll see as you receive the videos through this week. Like there's early phase and then how to advance it as you get stronger. But the key area, there's kind of 3 areas. I said walking. I'm not jogging, not running, walking. Movement that is fun. And then these foundational core, pelvic floor, and hip stability exercises. Also includes your back, caring for that back, and more about releasing the back. Moms' backs tend to be really strong because their cores are not. So we're seeking more balance between the front and back. So moms' backs are so tight and the fronts are just not. So we're strengthening here and learning ways to release there. Okay, so let me touch on walking. I tell all my clients you should start walking. That's the best. It's like it is probably, I didn't look this up, but I think it's probably the most researched form of exercise, and obviously is readily available to all humans. So considerations is when you're walking. So I don't want you to just go for a walk and like not think about what you're doing. It's kind of a cross between going from that functional exercise to the formal exercise. So walking can be functional. We walk to the bathroom, we walk around our house all day. That's functional walking. And it can be more formal, going out like this, mom, on a walk, pushing your stroller. Okay, when you're doing that, or intermittently during your day, like I'm getting up from my desk, I'm gonna go walk and get a drink of water. Okay, let me refocus on my posture. Let me think about how I'm breathing. So you're doing it mindfully. And then there's a progression, which I'm gonna offer on the next slide. Is it functional or exercise? It depends on how you're using it. We all walk every day, so it's of course functional, but we can make it more formal. This is say functional or formal exercise based. We can make it more formal by having a strategy for ramping it up like this. I think this is it. Yeah. Okay. So this is my postpartum walking progression. Of course, this could be any, like it doesn't have to be immediately from 0 weeks from immediate postpartum, but really it's the idea of how slow and patient I want you to be with the progression. So you're slowly increasing the time, the number of days per week, and the intensity at which you're doing it. Any return to any exercise routine should be similar to this. So how often you're doing like squats, how many you do, how intense, are you holding weight or not, and how many times a week you do should also progress in a similar way. So charts are great. Tracking, there's so many apps and different things for tracking what you're doing. I think those are any sort of tracking app or fitness progression app. Don't have any specifics to name, but I think that's all great because mom brain, it's hard to remember. And so if we just write it down somewhere or have an app that can track it, or your fitness watch, of which I never had one, so I don't really know what they can do. But tracking in there is great, so you don't have to remember. But the progression, basically the first 2 weeks, I'm like, no, don't go for walks. If you want to get up, should be on your own property, assuming you have a small property, leisurely stroll. There's no time goal and it's only as tolerated. As soon as it doesn't feel good, you should be stopping. And then at the 2-4 weeks, so this is all based off of if you are doing this immediately postpartum, based off of your lochia flow. So if you're still bleeding, you want to be very cautious. If your bleeding is really trickled down to almost nothing, that's where you really can start progressing better. And the lochia is a good sign that you're progressing too fast because your bleeding will go up again if you're doing too much. So that is one of the best signs that you're not listening to your body, is that you start bleeding more heavily in early postpartum. That's a sign that you need to go back a phase or 2. Okay, so if you start walking at 2 weeks and your discharge increases, you need to take it down and wait. Your body's not ready. And so goes for this whole first 6-8 weeks postpartum. But 3 to 5 times a week, I think 5 times a week would be very aggressive. It's a leisurely stroll. It's like you're just strolling around the block for 10 minutes. That's what you should be doing at that phase, if at all. 3 to 5 times a week still, but now it's more like a slow walk. Like there's a little more intention involved, so that intensity is ramping up. And you may be bumping it up 5 minutes. So if the week before you were doing 15 minutes, then maybe you do 20 minutes. Increase by 1 day and 5 to 10 minutes each week up to 30 minutes. So if you ended this phase at 3 times a week for 10 minutes, you might start week 4 at 4 times a week for 20 minutes. I'm forgetting exactly what I just said, but I think you get the idea. But not exceeding 30 minutes. 6 to 8 weeks. So this is when you really start there saying, okay, you can go exercise. You might be like, can I? I'm not sure. Well, try to do a little more, see what happens. I mean, a 45-minute walk is pretty long. It's still at a slow pace. It's like you're trying to walk to the bus stop, but you're not late, but you do have to get to work. So like there's some intention behind it. You can talk on the phone, no problem. That's the pace. Doing it a little more often per week. And again, increasing. So if by the end of 5 weeks, you're at 30 minutes, well, yeah, pop it up to 35 minutes. Maybe you're already doing it 5 times a week, which is fantastic. Just going at a little heavier pace. Okay, and then beyond that, exercise pace. So what exercise pace is where you're not talking on the phone. And you're going, it's with intention, it's starting to get that cardiovascular benefit, that bigger cardiovascular benefit. You might be even easing into like a little jog for a minute here and there towards the end of this phase. Okay, so that's a sample progression. All right, this is huge. So when we're moms, we have such limited time to take care of ourselves and our bodies. I think it's important, especially if you did something previously that you really enjoyed. Like maybe you were a dancer. I love hula hooping. Just sounds so much fun to me, even though I can't do it for the life of me. But you did something that was active and enjoyable, surfing. I think this should be prioritized in that ramping phase or the performance maintenance phase. In the reconnection phase, it's often just too early, and that phase is just so critical to your ability to engage in it. Like I didn't do that reconnection phase. I went straight to boogie boarding and I destroyed my core. So it's been repaired. You're not going to do anything likely that you can't repair, but you can prevent it in the first place by not skipping the reconnection phase. But finding what's fun. I mean, you only have maybe you have your husband or your partner will watch baby like 2 or 3 times a week for an hour for you to go exercise. Do you want to go to a class that you don't enjoy? Or do you want to do something that's fun? That's like that. You look forward to it before, you love it while you're there. And after you have this like glow and thrill and those endorphins flowing, and it's totally worth that 45 minutes. So whatever it is, make it a priority. The more fun you have doing it, the more you're going to return and show up and keep doing it. So that was my barrier with the Fifth for Mom is I'm not an extra group exercise kind of person. It was great because I could actually get there because I could bring my baby and I could do it and I loved it. But as soon as I had a little more bandwidth through doing things that were more fun to me, I went towards those things because I just found them more enjoyable and more fulfilling. So going with what feels good is really important when it comes to exercise because you're going to keep coming back. But you need to be doing some foundational exercises in addition to those things you enjoy, unless I don't think there is no less. I was going to say maybe unless you're doing yoga or Pilates where you work on a lot of this stuff, but I don't think that that's true. I think that these things you need to be doing regularly and with intention of this is kind of a maintenance program that I just need to do to keep my pelvic health and my overall health in optimal working order. So these are things that are going to improve your core, your pelvic floor, your spine and hip stability, strength, mobility. They reduce your risk of injury. And I think I can't highlight that enough. These are very much a lot of these exercises are ones, I mean, I'm a therapist, I'm an occupational therapist, worked in clinics for years, and these are the kind of exercises you're going to be given if you seek out pelvic floor therapy. Now they're going to have a more personalized approach that addresses your specific problem, but doing these to begin with, a lot of these exercises I've introduced to people are given cues, like a squat, like we call them squats, but the cues you get, and I'm hoping that's what you can take away from this session over the next week. Some of the ways I describe these things and what to focus on gives you a new perspective of how they should be being performed to minimize risk of injury and optimize your pelvic health. So you want to do them regularly, and you certainly want to be doing them with intention. So just a side story, when I worked in a clinic, there were some physical therapists that would often just chat with their clients while they were doing exercises. And I never said anything. It's not my place. Her patients loved her. But for me, I was someone who wasn't as chatty, because I would always be talking to my patients about, like, I want you paying attention to your body as you do this. And if we're chatting, you're thinking about what we're saying and not focusing on what you're feeling inside. And I think you're going to improve better and faster if you pay attention to what your body's saying and then tell me what it tells you so I can instruct you. So I wasn't a therapist that would talk a lot when my clients were doing exercises, because and that's what I mean when you're doing this. I want you to do it with intention. Focus on what your body is telling you instead of watching TV. The common thing is moms have their baby like on them, their children crawling on them. And I know that can be unavoidable, but if you can just focus for that 10, let them do their thing around you, make sure they're safe, and then do your 10 reps, or have someone that can watch, is really important for you to be able to do them with intention. And seeking support if you're not sure. That's a huge function of my Windward Maternal Wellness Facebook group, is for moms to reach out to me and be like, hey, can you give me a tip on this exercise? Or I'm trying this and it's not working. I'm always happy to offer some support in that way. Okay, so these are the kind of the categories, and you'll be seeing this as I send out. It may not be in this exact order, but I'm going to show you, actually, we're going to talk about deep core activation today. And then tonight, I'm going to send out the glute and butt strength progression. Coordination of breath and muscles. We've already kind of touched on this, but this is also, I don't think I'll send this one till later in the week. It's the 90-90 exercise, although maybe I should just pop that out to you. I haven't quite decided the order I'm sending these to you in. Quadruped, which is all fours. Supine, which you're seeing. Actually, this is a bridge. Wall plank series, sideline twist. These are kind of the categories. So notice that, well, bridging is a specific exercise, but a lot of this is positional. So a lot of my clients will come in and I'd say, okay, well, what do you do for core strength? And they're like, oh, I lay down and I do sit-ups. Or they're always doing their core work in one specific position, and they're doing their exercises in one specific position, often supine, like they're laying down and doing core work. And I'm like, well, we got to work this system in all directions, which is quadruped, it's standing, it's on your back, it's on your side, it's at the wall. There's so many different positions, and you should be incorporating a blend and mixture of all of them to get the most well-rounded results. Okay. So this is an example of a postpartum exercise progression. So kind of in line with that walking one. So the first 2 weeks is just rest, essential tasks only. You should be sleeping, healing, and bonding. You might initiate Kegels, do a little mountain posture, do some deep breathing, but that's it. 2 to 6 weeks is functional movement activities and body awareness. So this is where you're in that reconnection, really getting into that reconnection phase. Intuitive movement, chest openers, all that breastfeeding. I'm going to show you a chest opener in a minute. low back relief, core awareness. So these are some examples. I'm happy to repost this on the Facebook page if you'd like. 6 to 12 weeks, experimenting with exercise more, kind of easing in, ramping up a bit, getting that core and glute engagement going more, dynamic movements. That's that counter squat that was on that last page. As ifs, which we'll talk about over this week, and bridging are some great ones in this stage. And then as you get further along, you're going to start going into more complex movements like dead bug, which I may have to demonstrate today. That's actually not in one of the videos, but I could always post a Facebook Live of it. More dynamic, a lot more complex, and you need to have a lot more control and strength and stability before you're getting, so you're not starting here. Okay, so today, initially I was going to demonstrate, well, I think you're all pretty aware of the transverse abdominis activation, and the cue I've always given for that is pulling your two hip bones together. So it doesn't change. I'll go through that briefly. A psoas release. So I haven't talked much about this muscle, or it's not a pelvic floor muscle. It's a hip flexor. But it goes from, let me stand up and show you. So it goes from like your, oops, that's like way too low. This is the one problem with doing some, actually it goes from about here and it wraps up and attaches on your spine. And often I can palpate some deep tightness, or moms will be reporting having kind of deep tightness in and through this area. So this is above my hip bone. And commonly, if you look on Dr. Google will be like, do like lunges or these stretches for hip flexors, like, the good old quad stretch like this. That does not get your psoas at all. And in fact, when you're having that tightness, we want to release it. And so pretty much across the board, I recommend a psoas release. I'm going to demonstrate that today. I think it's definitely among those good foundational exercises. It isn't really about strengthening, but it's about keeping that balance. When your psoas is tight, it can certainly cause low back pain. It's also a muscle, it's called it has many names, so it's like the emotion muscle. It's where we hold a lot of emotion, and it's a muscle that responds to stress by tightening up. So you can stretch it all day, but if you're not releasing it, it's not going to change and shift. So I have a particular release that I really like that I'll demonstrate. And then standing core, if we have a minute, I don't think I'm going to get to that today, but I might incorporate that on Sunday, because I, believe it or not, am a super lazy exerciser, which is something I've learned. And I really enjoy doing standing core exercises because I don't need to do anything. I don't have to get on the floor. I don't have to arrange anything. I can just start it. So I love standing core exercises, and you can do a lot with that. So I'll probably incorporate this. In the email, I had said I would do it Monday. Unfortunately, since I sent that yesterday, a commitment popped up that links with my daughter. So I'm not going to be available Monday at 9 a.m. So I'm going to try to do it Sunday night. I think most of us are available at Sunday night. So feel free. It's a Facebook Live. So I'll do it in the Pelvic Health Essentials group. So if you can't join live, you can always see the recording. And it's just going to be kind of my go-to routine, which makes perfect sense that it includes standing core with that, because it's like one of my go-to things. And then if there's any questions after, I'm happy to stick around and answer questions. So this is kind of the video demo series. This order may not be the same. I think 90-90 exercise is such a foundational, like a really key foundational exercise that all of you in this course, I encourage you to start doing. I would be demonstrating it right now, but it's really hard to with the camera and where it is in my room. Okay, let me pop out of here and start demonstrating some things. It is about 13 minutes before 5. We'll probably run 5 minutes over an hour, but thank you for watching this week. These are, again, what I want you to think about in terms of where you're going to start. What stage are you in? And looking back at okay, what do I need to be working on then? What will you focus on this week? Where are you going to start? You might take some of the exercises that send out over this week, or just some things that maybe if you're in the reconnection phase, like, oh, okay, I shouldn't be doing a lot of what Hillary's showing this week. I need to go back to what we already learned and start there. How will you know you're ready to advance? Identifying that for yourself. What are your signs and signals that you might be able to advance? And getting as clear about that as you can. In what ways will you listen to your body? How are you going to tune in? Thinking about your environment and the intention around why you're showing up to do the exercises. And what will keep you coming back? So as you're trying to establish a routine, you need to figure out your why. Why do I even want to do this? What's going to make me show up? What is the motivating factor? Some people respond really well to rewards. Like, if I do this for the next however long, I will X, Y, Z. Others just want to show up for more intrinsic reasons, and that's fine. There's no right or wrong, but just identifying that why. What's going to get me coming back? Why do I want to do this? And knowing that, labeling that is really important. Okay, I'm going to pop out of this sharing. Okay, so if you have any exercise that you want me to focus on or show, let me know. I do have a little list over here. The camera angles will be kind of funky as we do this. But first off, I wanted to, so you do not need much equipment. I do keep some light weights around. That is not for the stages of exercise we're in, but really all you need is, I love these half rollers and yoga bricks. And this is kind of a not very thick one. It doesn't matter what width they are. So for sake of time, actually I want to show you what I do with these. And sorry you can't see my face, but the important part right here is my legs. So calf stretching. So moms tend to sit a ton, breastfeeding and all of that. It's so weird that you can't see my face. Let me explain this for a second. And our back bodies get really tight. I talked already about the tightness in moms' backs, but that just extends down through the hamstrings and into the calves. So doing a daily calf stretch, I think is great. For a long time, I kept this yoga brick at my sink in my bathroom, and in the morning, I would just put my toes up on it. So for the calf stretch, I like this half roller, which you can order these. It's just called a half foam roller. Sorry. You can order it on Amazon. You're gonna make sure you get, so kind of going to the side. So you don't want to be tight roped. Standing to the side, you're gonna follow your foot up and getting your weight into your front leg. Now I'm doing mountain posture, as straight up as I can. I know you can't see the top of my body. I'm trying to look straight ahead. Now you may be really tight, and that's okay. What you're gonna do with wherever you're at, you want to be able to tolerate it while breathing. So it shouldn't be so intense that you're like, oh my God, like quivering and shaking. So as your calf loosens up, and for some people, they're always tight. They're never going to get this back foot any more forward, and that's okay. So notice there's not weight in this leg. All my weight is in my stretching leg. And what we try to do is get to a point where we're standing stretching leg. And then you would switch to the other side. I'm going to do quick so I'm just not super lopsided. So again, very light in this foot. So my weight is not back here, it's in my stretching leg. Oops, I'm falling over. And you're slowly trying to see if you can progress, keeping that heel down and having it in front. It's okay if you never, ever, ever get here. Some people are just tighter. Okay, so other thing I do, and I'm down, oops, I can't really see me, that I love this for is a chest opener. So and a lot of moms get really sore through their mid-back. So there's two ways we can use this. The little bit less intense, so this is kind of short, but it does work. Is I put it down on the ground, and I'm going to align my hips to it. In our clinic, we have longer ones, and then I need this in my head. My head's not like falling off. And just slip it in back a little bit up high. Okay, so right here, ooh, there we go. This is kind of opening up my chest. Now, because it's a little short, it's a little awkward, but this is a little more gentle than the way I'm going to show you next. And I would just lay here, breathe. Again, releasing. So foundational, you need to release and strengthen. You don't want to just be strengthening. So now I'm going to turn it, and it's going to go at my bra line. Okay? Oh. Get that there. And this will really open the mid-back. And I'm going to put my head lower, and this is an amazing stretch. It's actually opening up your chest as well. So instead of doing like the corner pec stretch or along the wall stretch, like you may have seen in the postpartum mama self-care deck, I have that one where I'm along the wall. This is a different variation that helps kind of unwind that rounded thoracic spine from slouching and slumping. It also opens up and gets your pecs open again. Okay, and you're going to just stay here for about a minute is fine, 5 minutes. All right, if you don't have one of these half rollers, what could you use? So you can use a rolled out, those yoga blankets are really great, or just a really dense towel or dense blanket. Pillow, that's the bolster, those can work as well. Okay, so as release, this is that I definitely want to demonstrate. So you need a yoga brick. There really isn't anything else that works quite as good as a yoga brick. So I suggest getting one for this. And what you're going to do, you're going to be scoot pretty far down on your mat because you're going to be slowly moving up. I am going to do this on fast forward. This release should take a minimum, you should be spending 4 minutes here. So all I just did was place the brick on this, so I'm resting on this surface under my sacrum, on my bottom of my spine. And I'm going to just lay here. You're not going to feel stretch. This is not a stretch. In this position, the psoas muscle is slacking. And similar to, because it's not a muscle that you can really get to, there's a lot of organs in the way, and then it's very deep down. So you can't just press on it to get it to release like you would a trigger point. Where you press on the belly of the muscle for 90 seconds in its slack position. It tends to just, instead of being all tight, it tends to just be like, oh, and it releases. So the psoas is a muscle that's next to impossible to do that. And anyone who's saying that they can kind of questions. So notice now, I'm wiggling. What I am not doing, I kind of adjust my feet, but I'm never lifting my butt up, okay? I'm going to, every minute or so, just slowly drag myself off. And you're going to feel, you can't see it yet, I don't think, but the block's going to slowly tip. Okay, so I wait to hang out, relax, listen to a guided meditation, do some meditation yourself, whatever. Wiggle, 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 okay? And you're going to see, I'm fast forwarding this. So I only wiggle about an inch each time. Breathing, wiggle, wiggle, wiggle. And eventually, like now, my butt's basically off. So I just kind of take my hand and I flick it out. Okay? And I just wait here and relax for another minute. And then when I lay flat, I should feel like I'm more connected to the floor. Okay? So you can test by just laying flat like this before you start. Doing the release that I just showed you, and then coming back and laying flat again. And almost always you're just going to feel like, oh, I just feel like I'm more connected to the floor. Because if you think about a tight hip flexor, it's going to pull you this way. It's going to kind of pull you up off the floor. So if it's release, I'm exaggerating that, If it's released, you're gonna feel more like you can nail this onto the floor. Okay, so that is absolutely a foundational exercise. Let me check our time. Okay, so oh yeah. Okay, this was a good one I wanted to show you. So this is a hip, we call a hip tightness. So you're kind of looking at, you do it at the wall. I'm going to turn around and you're going to have my butt facing towards you. But this is to kind of see which is one hip or the other hip more tight. And it involves your glutes down to your hamstrings, calves, all the way to your feet, and the psoas and all these deep hip muscles. So you're going to go to the wall, or you could, I have this chair over here. I can even do it here, and you'll be able to see maybe a little bit better. Okay, so I should have, this is a little low, but I'm going to try this anyway. So my feet are even, they're about hip width apart, and all I'm doing is bending in, and then bending in. And I'm seeing if one side feels a lot tighter than the other. Okay, and I can feel as I bend my left leg forward, there's a lot more pulling and tightness. So that tells me my right side is tighter. When I do my left leg straight and my right knee bent, I don't feel much in that side. Okay, I'm going to show you the wall real quick so you can see the back version. So you'll be at the wall. And hips are at 90 degrees. Okay, and I just kind of bend in. That feels good. And bend in. Ooh, and I feel all that tightness right through here. Into my butt and my back. Okay, so that's a little bit of a quick kind of diagnostic for you to know, like, I have more tightness on my right side. And this makes perfect sense because I hold my children on my right side and I'm tight, tight, tight. So when I'm approaching releases or stretches, I should spend a little more time on the right. So with that calf stretch, when I put my right foot up, I should spend extra 30 seconds, extra minute there. Okay, so that's how that can inform you. All right, half lunge. So this is what I think moms are commonly doing to release hip flexor tightness. It is a good starting exercise early on. And what it is, so you're going to come down on all fours, quadruped, and then you're just bringing one foot in between. And you might even be staying here to start. So when I'm doing this, though, what I'm watching out for is that I'm not shifting my hips. So now my hip points are that way instead of that way. So I want to keep my hips squared up. So if I just come up, which you're not going to do right away, you're actually probably going to stay there. I'm checking, am I in neutral? Let me switch my legs. I'm going to be able to see this a little better. Am I in neutral pelvis? So pubic bone, hip bone. Whoop. There, now I'm neutral. Notice I tend to posterior tilt. See, my fingers are not lined up. That's a posterior tilted pelvis. Oh, look, you can't see this hand anymore. Neutral. Okay, I want to stay in neutral as I come forward, making sure I don't slip it like that, like let it slip to the side, because then I'm not facing forward. Okay, so staying in neutral. If you're not sure where neutral is yet, or you have trouble finding it, take the time working on that before you dive too deep into exercises, so you're going to get yourself in trouble pretty quick. Okay, so this is just a hip flexor, more of a stretch. It kind of gets the psoas, it doesn't completely. There's really no good way to stretch the psoas, which is why we should be releasing it instead. So coming back, we can also just come back and get the hamstring as well. So kind of yoga base, this is why I do really think yoga is a great approach to restoring your body. So I do like restore your core. It's a yoga-based approach. So I'm checking, I have my hands on my pelvis and checking that I'm staying forward and I'm getting this nice stretch down my back leg. Okay, and then I would shift and come back. Okay, I'm not holding real long for sake of time right now, but I always recommend holding for 30 seconds at least. Okay, let me see. I did almost everything. Half lunge. Okay, last one I'm going to demonstrate right now because these are ones that are not in the videos that I'm sending. Is early on is when you're laying on your back to be able to find that neutral spine. Okay, so